Hi guys, this is Dr. Priyanka Mehta. So in the previous video I was talking to you about ovarian cyst, and we spoke about follicular cyst and corpus luteal cyst, and we understood that follicular cyst and corpus luteal cyst are just normal variants. We don't have to worry about them too much. Of course, make sure that you have consulted your gynecologist and your doctor to be absolutely sure about what you're having. Now sometimes the ovary, which if you can see here, the ovary is 3 into 2 into 1 centimeter. I have told you also previously. So every month the ovary gives out an egg, and this egg sometimes is not coming out. That forms the follicular cyst. Sometimes the egg comes out, but whatever is the remaining part forms the corpus luteal cyst. But certain times there can be certain different kind of cysts. Like there is a kind of cyst called the dermoid cyst. So what is this dermoid cyst? The same ovary that we have, this ovary has lot of different kind of cells. So a dermoid cyst is a special kind of cyst which cancer or malignancy is just about 1% in a dermoid cyst, but sometimes it can have different kind of components of our body. Like the dermoid cyst or the ovarian cyst can have hair, it can have teeth, it can have a lot of cholesterol, lipid, sebaceous material, hair, and all those things, bone. So dermoid basically is a kind of cyst which is going to contain material from different kind of layers of the body. You can have skin, you can have hair, you can have teeth, you can have bone, something like that. So dermoid cyst, on the other hand, you should not just postpone the treatment for dermoid cyst, because dermoid cyst can sometimes become very big. I have seen women, because ovary is usually very silent. When there is a problem in the ovary, whether it is a simple cyst, whether it is a cancer, the ovary, they say it whispers. The ovary sometimes will not give any kind of symptoms till the cyst or the swelling becomes very big in size. So I have seen dermoid cyst of even up to 25-30 centimeter size too, when we will be not be able to remove that with laparoscopy, but we will have to make a big incision, a big cut, and remove that dermoid cyst. Sometimes this dermoid cyst can twist or turn on itself also, which is called a torsion of the ovarian cyst. So understand that not all ovarian cysts need surgery, but not all ovarian cysts are the same. So you have to understand that if you have been diagnosed on ultrasound as to be having some kind of a cyst in the ovary, try to understand what is the kind of cyst. If it is a follicular cyst or corpus luteal cyst, then you can wait, but do meet your doctor for it. If it's a dermoid cyst, even if it is a small one, it is better to get it removed, because with time it will slowly keep increasing, and that can cause problems, because a cyst in the ovary which keeps increasing, there is a risk of cancer, but there is more risk of it sometimes just rupturing inside. So then there can be irritation, it can cause a lot of bleeding inside, or it can just twist and turn, and that can cause very severe pain. In that severe pain condition, sometimes you may not even be able to do in certain centers a laparoscopy. So make sure that if there is a dermoid cyst, you go and meet your gynec, you go and meet your doctor and get yourself treated. So thank you and take care.